Hi everyone, Dr. Obi from Walkaway Back Pain. Today, part 3 of our 3-part series on stair climbing to help with lower back pain. We're going to be discussing today the rotation of the hip and the thorax in relation to dysfunction and asymmetry of our abdominal and back muscles as it relates to reducing lower back stress and pain. Hope you enjoy. So today we're going to conclude our 3-part series on stair climbing and changing the mechanics of how we climb stairs to reduce lower back stress and pain by addressing rotational or twisting mechanical problems that the body has. Many of my patients with lower back symptoms, as well as my online clients that I help with designing exercise programs and figuring out their mechanics through Zoom consults, have a tendency to have rotational problems, both in the hips and in the torso. Now, sometimes when you stand in front of the mirror, you won't necessarily see that. You'll see that your hips are pretty straight and your chest is pretty straight. And the mistake is thinking that I don't have a rotational problem. But if you look a little deeper into mechanics, most of us have a tendency to walk or stand with one leg pointed out slightly more than another. This sets up a rotational tendency of mechanical error in the pelvis, which affects lower back pain. As my leg has a tendency to move outwards, or if I chronically cross one leg over another more than another, it creates this external rotation or outwards movement of the thigh. The pelvis in relation to the thigh has a tendency to rotate the opposite way. The problem is with pelvic rotation and external rotation of the hip, it produces a hip hiking motion pattern where there's a sideways compression on that side, and usually tighter hip flexors on that side, and a corresponding reflexive weaker buttock and overactive erector spinae muscles. This mechanical problem sets up more compression and irritation on that side of the back than the other, and an overstretching stress on the opposite side of the back. You can check this on yourself by simply doing a test where you stand and swing your hips right to left. And many times what you'll notice, if you keep your feet locked in straight ahead, you will have a little more motion moving your hips to one side than another. And the side that feels a little tighter is usually the side of the leg that turns out, or a pelvic tightness or asymmetry. Your muscles are stronger in swinging your pelvis this way. They have more flexibility. The fascia and the soft tissues are set in that pattern because you use that all the time when you set yourself up with either a leg that moves outwards, or sleeping position, or sitting position. As a result, this pattern sets up an asymmetry between abdominal obliques, erector spinae muscles in the back, the latissimus muscles, and it creates a slight rotational stress throughout your lower spine. You can do the same test on your chest. Keeping your hips straight ahead, move your shoulders to one side or another, allowing your upper torso to move. As long as you don't move your hips, again, you may find a similar pattern where one side feels a little looser and another side feels a little tighter. Again, this sets up the same type of muscular asymmetries between the torso and the pelvis that affects the lower back that sits in between these two areas. So we're going to take this into consideration when we do our stair step today. Let's take the example that on my left side, my left leg likes to turn outwards, external rotation. And as a result of that, my pelvis likes to turn to the right more than it does to the left. When I climb a stair, number one, I want to make sure that my foot is straight ahead, not angled out. And as I go to put weight on that foot, I want to make sure that I'm moving my hips in the direction that they're usually tight and rotating to, which in this case would be rotating my pubic bone to the left-hand side, or turning my entire hips to the left. That closes the hip joint as I come up and allows my abdominal obliques, my latissimus, my erector spinae muscles in my back, all to set a new pattern of rotation and to learn strength in that particular motion, which is climbing the stairs. If I had a rotational problem in my torso, let's say that my pelvis was okay, but I had a tendency to move more to my right side with my torso, meaning that I have a lot more motion this way and I feel a little tighter this way. That's associated with the dominant latissimus dorsi muscle. This muscle on this side is used to moving back, the other side isn't. There's a chronic pulling because the lat dorsi attaches to the lower back on that side. So if I'm inhibited or if I'm weaker or tighter moving to the left, As I take a step up, I want to make sure I'm turning my chest in relation to my pelvis, not my whole pelvis, just my chest and rib cage, slightly to the left as I come up. Again, these rotational corrections do not have to be great in distance or range of motion. Sometimes just a half an inch of motion is enough to contract the muscles in the right way. And if you practice this every time you're walking upstairs, you're going to be gaining a strengthening stimulus, which over time is going to keep you stronger in your weaker muscles, providing balance and symmetry to the forces that act on your lower back pain. If you like this video on rotation with stair stepping, check out our channel, subscribe to it. We got a lot of great videos out there to help you. Questions or comments, write in. As always, I'll do my best to answer them. And remember, if you're looking for a great program to analyze your body mechanics, to figure out how to use simple modifications in my walking steps, most of us walk 5,000 to 10,000 steps a day anyway, by changing the way we walk, we can actually get a rehabilitative workout in through the day without taking extra time or going to a rehab clinic or hiring our own personal trainer, simply by understanding our bodies and what our mechanics are doing and how that relates to stresses on our low back. If you have trouble analyzing your low back mechanics, you can always get an online conference with me through Zoom, but many clients have enjoyed the Walkaway Back Pain program available at painfreeandfit.com because it teaches them the analysis of their mechanics and how to simply implement exercises that are corrective in nature and strengthening in nature to corrective mechanics to help relieve stresses imparted to the lower back, thus helping in lower back pain. I hope you like this video on torso and pelvic rotation with stair stepping and helps you with your chronic lower back symptoms.